Dear students, welcome back. In the previous session, we have discussed about superficial fascia. Now, in this session, we are going to discuss about deep fascia. So, in the leg, in the leg, tibia and fibula are partly subcutaneous. The most notable being the medial surface of the tibia. That means the medial surface of the tibia is subcutaneous. Okay. And also the malleoli. So, the malleoli, that is medial and lateral malleoli. Over these subcutaneous areas, the deep fascia is replaced by periosteum. Okay, now we'll see the extensions of the deep fascia. The extensions of the deep fascia which forms the intermuscular septa that divide the leg into compartments. Okay, so intermuscular septa. So the name itself indicating that it is going to divide in between the muscles, and that one divides the leg into compartments. So the anterior and posterior intermuscular septa. So here you can find this one is the anterior intermuscular septa as well as the posterior intermuscular septa and posterior borders of the fibula. So they divide the leg into three compartments. One is the anterior compartment, anterior compartment, lateral compartment, and the posterior compartment. So the entire thing is the posterior compartment. Okay, yes. So here you can find the green part that is the deep fascia. So these are the deep fascia which are dividing as intermuscular septa. Okay. So the posterior compartment. So again this posterior compartment is further subdivided into superficial. So this one is the superficial, intermediate, and the deep parts. Superficial, and then intermediate and deep parts by superficial transverse intermuscular septa and deep transverse intermuscular septa. Okay, so simply we can call it as transverse fascial septa. What do you call? These are called as transverse fascial septa also. Okay, so around the ankle, so this is the thing you have to consider in the anterior part of the leg. Around the ankle, the deep fascia is thickened to form a retinacula. So these are the retinacula. So these are the modifications of the deep fascia. That means it forms a band-like thing. Okay, so that deep fascia is thickened to form bands called retinacula. These are so called because they retain tendons in place. So where it is? Around the ankle. So on the front of the ankle there are superior and inferior extensor retinacula, and laterally we can see you can find superior and inferior peroneal retinaculum. So this one is superior and this one is inferior peroneal retinaculum. And posteromedially you can find the flexor retinaculum. So these are all the modifications of the deep fascia. In the next session we are going to discuss about the extensor retinacula. Thank you.